Hi guys, my name is Elena Starobinski and this is video number 2. Today is August 4th, 2019. This is pathophysiology. Today I'm going to be talking about peripheral arterial disease. Peripheral arterial disease is a disease of your arteries. What happens is your arteries get filled up with calcific plaque and fatty deposits, and it narrows the lumen of the vessel, and the blood has a hard time going down lower into your extremities. So usually patients experience lots of pain in their calf area or in their feet, in their legs. So they come to the office and they complain of the pain in their legs, and it's usually brought on by the exercise or some kind of physical activities that they do. They would say, I can walk a couple of blocks and my legs start to hurt. Or they would say, as soon as I start exercising, I get the sharp pain in my calf. So doctor usually prescribes several different tests. So the first number one test that doctor prescribes is ankle brachial index test. Ankle brachial index test is usually it's a measurement of your brachials and in your ankle pressures. And your ankle pressure is supposed to be higher than your brachial pressures. So if they're lower, usually there's a problem. It means there's not enough oxygenated blood goes down into the lower extremities, and the pulses are usually go down too. So we have a hard time finding pulses and or hearing them. After the test, if the test is abnormal, doctor prescribes another test. We usually do ultrasound of the arteries, and we measure, we check all the major arteries in the legs, and we measure the velocity, and we can rule out the stenosis of each artery. So we can go into, we usually start out with common femoral artery. After that, we go into profunda, we measure that. After that, we go into femoral artery, proximal and distal area. We measure popliteal artery. We measure PT artery. We measure peroneal arteries. We measure anterior posterior artery, and we measure dorsalis pedis arteries, and then plantar arch. And that way we can tell exactly what is the velocity and how much plaque that we see inside, and we can tell how much stenosis that person has. If it's not bad, if it's just the beginning of the peripheral arterial disease, it could be controlled with medications. The doctor could prescribe aspirin or some kind of lowering cholesterol medications, and he would say that a person should have a better nutrition, less salt, low cholesterol, less frying food, and exercise. Exercise is very important because by doing exercising, your body can grow collaterals, and collaterals is very, very important because even if your native vessel is completely occluded, it can still feed your muscles by collaterals. So that's very good. So that's why all the doctors usually say that you should exercise. Next thing that I want to, after that, if the disease is severe, doctors can go into the arteries and have a surgical procedure. They can go in and clean out the arteries, put a stent in, and then I've seen sometimes the stents in our office. We had patients that their stents could collapse and close down, and the body could reject it. But because they exercise, the body grows collaterals, and they can still walk, and they can still exercise, and they feel fine even after the surgery when their stent collapsed. So I want to compare this to the arterial hypertension. Usually the patients have hypertension and it's not controlled properly with medications. Arteries become really weak, and they can break, and they can cause a stroke, or they can cause blood clots. They can cause aneurysms. So what are the aneurysms? Like stretching of the arteries in some areas. An aneurysm, if it's in an aorta, and if it breaks, it could be deadly. So, so controlling blood pressure is very, very important, and it's also, arterial disease. Another thing that I want to compare this to is the venous peripheral disease. So, what is a venous peripheral disease? It's called venous insufficiency. It's when the valves are not working properly, and the body has a hard time bringing the blood back up into the heart. So the valves are not working properly, and it causes pooling of the blood in the vessel, and there's pressure in the legs, and usually what it does, there's no problem with oxygen going down, but it's the blood going up, and what it does, it discolors the skin in the legs, and the skin becomes kind of like a brownish color, and patients suffer with ulcers, non-healing ulcers, and that's because the tissues are suffering with not proper circulation into the extremities. So, that I also wanted to compare another couple of things like peripheral disease. It's called Raynaud's disease. The Raynaud's disease is it affects a lot of women, and it's a cold fingers disease. It's usually brought on by stress or a cold. The fingers turn white, and they hurt. So that's another disease of the extremities. And there's another disease. It's called Berger's disease. Berger's disease. It affects more men, and it affects men because they smoke, and smoking is number one cause of that. And it turns finger blue, and it turns their extremities, feet, blue too. In some severe cases, the fingers and the toes would be amputated. So these are different peripheral diseases. I'm going to put all the citations of all the websites that I've used down below the video. Well, I hope you enjoyed this. Thank you so much.